Hello, everybody. My name is Erica Lyons, and I am the Life Renewed PD group host. And today we have Sarah Rapillard speaking today to us, and her topic is Parkinson's disease and vocal health. And I'm just going to give you a bio. So, Sarah is a speech language pathologist located in Southeast Georgia. She earned her Master of Science in Speech Language Pathology from Auburn University. She holds her certificate of clinical competence from the American Speech Language Hearing Association and is licensed to practice in Georgia. Sarah is also currently a member of the Georgia Speech Language Hearing Association Executive Council. Sarah has received extensive training in endoscopy from SA Swallowing Services as well as Emory University. She has specialized clinical interest in the management of swallowing and voice disorders, as well as in general laryngeal health. Sarah is also certified to provide McNeil Dysphagia therapy program, as well as the Lee Silverman voice training and LSVT Loud. Ladies and gentlemen, I present to you Sarah.
Hello, everybody. I hope everybody's having a great day. I'm excited to be here to talk about Parkinson's disease and how it affects the voice and some things we can do to help keep it healthy, as well as some common interventions that have a lot of good evidence for improving speech and voice in Parkinson's disease. My company is called Coastal Voice and Dysphagia Diagnostics, and I provide speech pathology services in the state of Georgia, both in person and sometimes virtually, depending on the patient's situation. And I see lots of patients with different disorders, ranging from Parkinson's disease to head and neck cancer, to singers, to all kinds of different things. So here we go. So in general, Parkinson's, I'm sure most of you know this, Parkinson's disease is a frequently occurring progressive neurologic disease. There are more than 930,000 people with Parkinson's disease over 45 years old right now, and that it occurs more frequently in men than women. Parkinson's disease stems from cell damage to the substantia nigra. There's a little typo right there. This area of the midbrain produces dopamine, and this is a neurotransmitter that assists with motor movement coordination. So a loss of these cells and that dopamine production results in decreased control of movements. So I say that as an overview because, you know, there's a lot of the changes in, you know, walking and limb movements, but there's also changes in the movements of the mouth and speech movements in general too. So common symptoms, you have the tremors, slowed movement, rigidity, impaired posture or balance, loss of automatic movements, flat affect, so that decreased facial expression when speaking, decreased speech volume, dysarthria, difficulty swallowing, and also sometimes cognitive changes. Physicians frequently use this 5-stage scale to classify the disease progression. You can find this little chart that's super handy for looking at, you know, how the symptoms progress on the Parkinson's Disease Foundation website. And they just have a lot of good information in general about Parkinson's disease and some helpful, you know, resources, and also information on voice changes and voice therapy and kind of how to get that help if you need it as well. So in general, how everyone's voice works, there are 3 parts of voice production. So your vocal folds are in your throat, in your larynx, and they produce sound. They come together like a wave and vibrate. And this sound is modified and amplified by the vocal tract, and that's called resonance. And that kind of just changes how your sound sounds, making it kind of specific to each individual person. And then different parts of your mouth, like your tongue and teeth and lips and the soft palate, which is the soft part of the top of your mouth that can move, it modifies the sound to produce words. And so that's kind of how typically our voice works. So Parkinson's disease impacts the voice by partially what it does is it can produce some glottal incompetence, which is bowing of the vocal folds. And this doesn't just occur in Parkinson's disease. I frequently see bowing of the vocal folds just in people who are aging in general, just because it's general atrophy. So that combined with the other changes from Parkinson's disease, like the decreased volume and changes in speech movements of the mouth, kind of just make the perfect storm of making it difficult to communicate what a patient wants to say or needs to say to have their wants or needs fulfilled. So this bowing appears as a gap between the vocal folds during phonation. And so basically in typical adults, when the vocal folds come together, they fully come together and there's no openings. And when you have the bowing, there's always a little gap between those vocal folds. And so that makes the voice sound weak or breathy, produces some hoarseness, might make the voice sound a little strained. And so you have that change in your voice, but then also the muscle movements of the tongue and lips and that kind of thing that have slowed because of Parkinson's also just kind of comes together and then can decrease overall intelligibility when the patient is talking to other people. So a patient should go seek services from a speech pathologist when there have been noted changes in voice quality, decreased ability to be understood by others, and decreased safety and participation in their current environment. So we see a lot of times a lot of social isolation once someone's not understood, because they get tired of people being like, wait, what did you say? I don't understand you. Why does your voice sound like that? And so it just kind of makes a lot of people not want to go do the things they used to do because they have this big change in their voice and they can't communicate what they want to communicate. And it's just more frustrating than it is fun. So once these changes have been seen, the patient should talk to their neurologist, ENT, or primary care physician. And typically they'll have a way to contact a local SLP who treats voice or speech and language changes in Parkinson's disease. And we'll talk some later about specific treatment protocols. And if your doctor doesn't know of anyone, depending on where you're located, you can get on these websites and look to see if there's anyone in your area who provides these specific services. And I know for LSVT, there's a virtual option. And so as long as the person's licensed in your state, you can still get services from that person as well. But the doctor will send a prescription or an order over to this provider for services, and then an evaluation can be performed to determine appropriateness of services in need, and they'll develop a plan of care with goals, and you'll go through a treatment program with that person. So there's some general assessment and treatment considerations. Early Parkinson's disease tends to be more receptive to therapeutic exercises. So treatment decisions will depend on the stage of disease and the domains that are impacted. Typically late stage Parkinson's disease reacts better to implementation of compensatory strategies. And so a typical speech and voice evaluation for a patient with Parkinson's disease will include a cranial nerve exam, a few different intelligibility measures, evaluation of the impact of decreased intelligibility on safety, communication of wants and needs, and the ability to socialize, and a perceptual voice evaluation and laryngeal visualization is recommended to make sure there's no contraindications to beginning some type of rigorous voice therapy. So there are a couple different common treatment approaches. First, we have the Lee Silverman voice treatment. It focuses on phonatory effort and instructs the patient to think loud. It's a high frequency program. You do it 4 times a week for 4 weeks, and an ENT consult is recommended prior to initiation of treatment. There is a certification required to complete the protocol, so you need to make sure your speech pathologist is certified to provide it. And you can find more information at www.lsvtglobal.com. They have a registry of all their therapists that are certified, and so you can look and put in your area and see who, and there's usually contact information for the therapist, so you can see who's available and who you can contact for services. And this is the one, like I said before, there is a virtual option for treatment. You just have to make sure the person is certified to do the virtual version of the therapy, because there is a course for that. And so, but as long as they're licensed in your state, they can do it virtually if you don't have someone very close by that you can see. Speak Out is the other therapy approach, and it's a 2-part therapy approach focusing on speaking with intent. You complete 12 45-minute sessions followed by weekly loud crowd group sessions. An ENT consult is also recommended for this prior to the initiation of treatment, and a certification is also required to complete the protocol. You can find more information about Speak Out at www.parkinsonvoiceproject.org. I'm not certified in Speak Out. I think it is a wonderful program as well. I would recommend either program for anyone with Parkinson's disease that's having voice changes and is interested in completing a voice therapy protocol. They both have really good evidence behind them and have really good outcomes. So both great options. So in the meantime, there are a few different ways to keep your voice healthy. And this really just goes for anybody, not just people with Parkinson's disease. It's just, your voice is a muscle just like anything else. And so it's important to do things to keep it healthy whenever we use it all the time. Because it's one of those things you don't really notice until something's changing with it. And then it's like, oh no, what do I need to do to help my voice? So first thing, hydrate, hydrate, hydrate. Everyone, I'm sure, has heard to drink 8 to 10 glasses of water per day, or a half of your body weight in ounces per day. And this is very important to keep your vocal folds lubricated and just not have things dry, getting too dry and then potentially causing an issue. Avoiding alcohol and caffeine. These things increase reflux and can also dry out your vocal fold tissue. Avoid smoking and secondhand smoke, also vaping, anything really that you're inhaling that's not, a humidifier or something is not the best for your vocal folds. Avoiding vocal misuse, so yelling, throat clearing, whispering is also considered vocal misuse, even though it doesn't seem loud. It's using your vocal folds in a way that is not the most efficient, and so long-term of that can cause some problems. And really incorporating abdominal or diaphragmatic breathing to support speech. So using that good belly breathing, not up at your shoulders, and making sure you have good posture. So, sitting up straight. And then it's also important to rest your voice for 10 minutes for every hour of talking. It's kind of like taking a vocal nap. So if you have a job or some kind of hobby that requires you to use your voice for extended periods of time, it's important to take little rest breaks. And if you have reflux, make sure you talk to your doctor about medication management, of course, but then there are also some lifestyle factors that can help decrease reflux as well, because reflux really can affect your voice without you realizing it, especially if it's silent and so it doesn't burn all the time, so you don't recognize it as easily. Because the acid it really just, can aggravate the tissues, because there's some delicate tissues in there, and it can cause some different problems with your voice and just make it a little less comfortable to use. You need to avoid alcohol and caffeine. These both can increase LPR and relaxes the esophageal opening, making it easier for the reflux to come up. Elevating the head of your bed while sleeping and avoiding eating 3 to 4 hours before you go to bed is important. Limiting intake of fatty foods, spicy foods, citrus fruits, fruit drinks, tomato-based products, carbonated beverages, peppermint and menthol. I will say too, take a look at your, oh my goodness, the word left my head. The cough drops. Take a look at your cough drops. Make sure that they are not menthol-based cough drops. Try to use pectin when you can, because the menthol is not good for your vocal fold health. Try to lose if there's excess weight, but obviously wait to exercise until your food has had time to digest. Quit smoking, and wear loose clothing around your upper body and waist. These can all impact reflux and make it worse, and which in turn causes some problems with your voice. So these are my biggest tips for really keeping your voice healthy while you're waiting for voice treatment, or even during and after, just to keep your voice healthy in general. And I think it's really important when you first see these voice changes to reach out to a licensed speech pathologist and get help, because the earlier you get help with the voice changes, the more effective treatment's going to be. Most of these treatment protocols have really good lasting effects. They don't last forever because Parkinson's disease is obviously progressive, but the earlier you start being in contact with an SLP, you can kind of keep up and keep it as strong as possible for as long as possible. So the earlier, the better, for sure. So I just really encourage that, and encourage finding someone who can support you in your vocal health. So here is my contact information. If anyone ever has any questions or wants to reach out about services, I'm happy to help, or happy to point you in the direction to someone who can help if I can't. So just let me know what anyone needs from me. Happy to be a resource.
Thank you so much, Sarah. If y'all have any questions or concerns, you're more than welcome to reach out to me as well. And we like to thank Sarah for her time today and speaking to our group.
Of course. Happy to be here.
Thank you.